All right. So on this part, we'll continue looking at how the muscles are named, and then I will touch base on few things that I think will be helpful, and then I'll highlight the muscles that I expect you to take notes for the purpose of your exams. When you look at this, so I'll touch on few things. So this is not going to be long. Now, muscles are named based on the directions the fibers run, right? So when you see muscles that are arranged in a parallel way now, we call it rectors. So when you see rectors, for instance, it's simply a word for parallel. So you talk about rectors abdominis. It simply means they are the parallel muscles in the abdominal area. All right. When you see transverse, it means the muscles are at 90 degree to each other. Then when you see oblique, it means it is at an angle. So oblique muscles will be that maybe there are some muscles like this, and then this muscle is now like this. This will be oblique because it's not 90 degree, so it's not transverse. This muscle is oblique. So you see there's another muscle. Let's say there's a muscle that is like this. This will be an oblique muscle, not at an angle. So we'll talk about those oblique muscles as well. Then size of the muscle is also another key. When you see maximus, for instance, now means is a large muscle. Is a large muscle. So we call it maximus. So now when you are talking about gluteus muscles, now we talk about gluteus minimus, we talk about gluteus maximus, and gluteus medius. So in that case, it means there are three muscles in the gluteal region. One, when you see it, that is the largest, that is maximus. When you see the one that is smallest, that is minimus. When you see the one that is the medium sized, it's not the largest, it's not the smallest, then you call that gluteus medius. So it simply means the mean intermediate muscle of the gluteal region. Now, the other part is, okay, we've talked about minimus. Now, when you see longus, for instance, longus simply means long muscles, long muscles. So it means there's a long muscle there. All right. So long, so you have longus. Anytime you see a muscle that is longus, it means it's long, it's long. When you see a muscle that is brevis, it means it is a short muscle. It's short, it's little, it's not long, it's not large. All right. So we talk brevis. All right. Now, deltoid simply means that the muscle is like triangular in shape. So we'll talk about the deltoid muscle, which I'm going to show you. You see the shape look like converging muscle. It's triangular in quotes rather. Now, trapezius, it's more like the muscle have two triangle in quotes, the way they are arranged. When you see serratus, like it's from the Greek word to saw, S-A-W, to saw, like to cut something also. But we'll look at that. Then Robundius, robust. Then orbicularis is from the word orbit. It's circular. All right. So those are key things in terms of direction. In terms of location, so muscles are also named based on location, like I've noted earlier. When you see a muscle, for instance, that is called frontalis. A muscle that is called frontalis simply means that it is in the frontal area. All right. So, like a key muscle here now, we call it occipitofrontalis. It means that that muscle have two bellies, or is occipital region at the back and frontalis here. All right, so we say frontal belly of that muscle, occipital belly of that muscle, and it's connected by aponeurosis. All right, then tibialis. When you say tibialis, it means it's around the tibia, and obviously the name of this muscle tells everything about it. It's tibialis anterior, meaning that it's in around the tibia and it's anteriorly located. Now, number of origin is another way that we name muscles. Like we talk about the bicep brachii now. It means it is around the brachium and it has two origins. So it is bicep. The one on the posterior area, still brachii, but it is tricep. It has three origins. Then quadricep means that they have four origins. We'll talk about the quadriceps, which I'm still going to talk about, are the muscles around the femur as well, the thigh. Origin and insertion. So like now we have sternocleidomastoid. And you know, they talk about this when you get to lab, you're going to see these muscles, sternocleidomastoid. Steno is from the word sternum. Steno is from the word sternum. And cleido is from the word clavicle. And the mastoid is talking about mastoid process of your temporal bone. Your temporal bone is part of the bones of the skull, you know. So we call it SCM. So you just call it SCM most of the time when we are talking about it in the lab, but it's sternocleidomastoid muscle. So that means that muscle originates from the sternum. So it actually have two origins. It originates from the sternum and the clavicle. So it is for the sternum and clavicle, and then it's inserted into the mastoid process of temporal bone. So its origination is on the sternum, and clavicle, and then the insertion is in the mastoid process of temporal bone. Then actions that muscle does, actions that muscle does also determines their name. So when you see muscle that we call flexors now, flexors, it simply means that they help to flex. So when you say flexors digitorum, it simply means they are muscles that flex the digits. It's as simple as that. When you say extensor digitorum, it means they are the muscles that extend the digits. So they are extensors. Abductors, it means they are the muscles that help to add something together. So like this now, adductor. All right. Then abductor. Abduct, to take away. Abduct. So this will be abductor. This will be adductor. So the muscles that bring together, so their functions also determines their name. Then levator. When you see levator, anytime you see levator, they are the muscles that elevate something. All right. Then depressor, they bring it down. So think about levator as elevator, depressor as they bring it down. Then supinator, supine position. So muscles that initiate supine position, or pronator, muscles that bring that make it to face down. Pronator, supinator, face up. All right. So the muscles are named based on that way. Again, like abductor, digiti, minimum. The word there is abductor, digit, and minimum. All right. Abductor, away. Digits, digitors, or digiti is from the word digits, and these are your digits. All right. And then minimus, it means it is small. Depressor helps to lower. Depress, lower. Elevator, elevate. Depressor, lower. So, yeah. All right. So it means that this is a small muscle. It means that this is a small muscle, and it's around the digits, and they are help to move the digits away. So that's what you see. So looking at the name of a muscle, in the real sense, except that we stress sometimes, the name of a muscle tells us everything about that muscle most of the time. So you see, abductor digiti minimi simply means a muscle that moves the little finger or toe away. The away is from the word adductor. The minimi digiti says that they are moving the digits, the fingers. And so abductor digiti minimi simply means a muscle that moves the little finger or toe away. Now, adductor digiti minimi simply means the opposite. This takes away, this brings together. All right, let's go. All right, so these are words that helps, and I will talk about some few things that I believe should be very helpful. So when you see Hunter against epi on top, Harpo on the side, longissimus is the longest. Longus means long. Longissimus means longest. So there's difference between these three, or these two rather. So when you see this, and those are a few things. So when you see longissimus, it means the longest. And as a matter of fact, the name is longest too. The name is long. Longus means it's long. Brevis means it's short. So this is short, this is long, this is the longest. Right? So those are a few words that we want to get ourselves familiar with, which will be very helpful when you name muscles or when you encounter muscles. When you see maximus, large, I talked about this, medius, medium, minimus, rectors, they are straight. All right. Rectors are straight. I told you rectors are straight, parallel the other time. Multi means there are many. Uni one, bi, two, tri, quad. Externus means outside. Internus means inside. So when you talk about external intercostal now, for instance, it means intercostal between costal cartilage and external, because there is internal. So anytime you see comparative words, I told you when we're looking at planes, anytime you see comparative words, it means there's another existing. So if there's no internal, like now, if there's no levator, there can be depressor. All right. If there's levator, that means there's depressor. So you just think of it that the opposite of what this is doing is what the depressor we're also doing. If there's no external, there can be internal. So when you see the word internal, it means, now if you see teres major, you know there's teres minor. If you see pectoralis major, you know there's pectoralis minor. So you just use the same logic to know where it's going to be, what is going to be where. All right. Now, if you see supraspinatus, it means there's going to be infraspinatus, because supraspinatus simply means superior, and infraspinatus will mean inferior, meaning that there's one above, there's one below. We'll look at that. All right. So I won't go through each of these, but these highlights different terms that helps to name muscles. Like this now, it helps to, so you look at these are the regions, different regions. And I tell my students, I don't know if I was telling you guys earlier, now there are some things that if you know, it helps, it takes away a lot of stress from you. Now we are naming bones, for instance, now, and you see you see capitis. I'm just using that as an example. You know, on the femur, there's fovea capitis on the femur. If you remember, there's fovea capitis on the femur, and capitis simply means head. You know, in my country, we use the word capital. So we say the state capital. The state capital simply means that uh, if you are looking at Texas, for instance, now, the capital of Texas is actually Austin, which is where the administrative office is. So we call that the capital. So that means the head of Texas is Austin in quotes. So the capital means head. So capitis means head. Now, so when you say fovea capitis on the muscle, I mean, on the femur, now, when you say fovea capitis, fovea is also a depression. So anywhere you see fovea, it means a little depression. So fovea capitis, it means a depression on the edge of femur. So that's the name fovea capitis. And You see, when you see this as well, cervices. Now, you know that when you are talking about the uterus, we talk about the cervix. The cervix is simply the neck of the femur. So when you say cervical bones is also the neck region, the bones, the vertebral bones on the neck, cervical. So this what cervical is not just implying that these are, it's not because these are just cervical. No, they are cervical, they are called cervical vertebra because they are vertebra around the neck. The name, it's actually vertebral bones. The word cervical is to differentiate what kind of vertebral bone is. Because they are located around the neck region, then the word cervical becomes the descriptive name for that kind of vertebra. So cervical vertebra, because they had to do with the neck. Cervix of the uterus, the neck of the uterus. All right. So when you see those words, they are words that cledo is clavicle, coccygeal is around the coccyx, costalis because there's costal cartilage, ribs. The ribs are coastal cartilage. All right. So those are the words that when you get familiar with them, you get to know that those are actually, when you see abdominis, for instance, now you know that's the abdomen. All right. If you get used to those words, it helps to help. Like allucis now is from the word allox. Great toe is allox. So they are named allucis. All right. Now, so those are going to help when you get to know it. Direction as well, they are key thing. Directions, anterior, external, extrinsic, all of that, they help to name the muscles. Nature of origin are key things that you need to know as well. When you see bicep, triceps, quadriceps, shape, they are key. Other striking features, all of those features, please look at them at your time. It will help you as you understand or as you encounter muscle. Right. Now, looking at this, muscles of the facial expression, what do I need you to know here? I will only require you to be able to name some muscles and the function that the muscles does, not to identify the muscles in the lecture. All right. In your lab, you'll be learning how to name, location of the muscles, you'll learn it there. But here, what I want you to learn majorly is to know, tell me, what does this muscle do? So for this case now, muscles of facial expressions, they are the muscles that um, they are the muscles that are responsible for what happens on your face. And so think about it. There's a muscle here. This muscle here, it's a muscle that begins from here, from the occipital bone, and continue to the frontal bone. All right. They continue to the frontal bone. So we call it occipitofrontalis. Now, when you see this muscle, this is the name of this muscle, occipitofrontalis. Now, it's not the muscle that runs through the entire length. However, the muscle begins from here and actually ends here. Here, you have what we call aponeurosis. And I told you when I was dealing with, I think, joints or muscles, no, joints, I told you that aponeurosis simply means flat tendons. It's still the same thing as tendon, but tendons that are flat are called aponeurosis. So these are flat tendons. All right. This is a flat tendon that connects the occipital belly. This is a muscle, and this is another muscle, but there is a connection between the muscle. So it makes it one muscle. So this muscle have occipital belly, which is the belly on around the occipital, and it also has a belly around the uh, frontal. This muscle is what makes you do this. You see, this muscle here is a muscle that makes this area to wrinkle when you flex it. I mean, when it stretches. Now, so this is frontal belly of that muscle, this occipital belly of that muscle. So those muscles are very important for what happens in your face. All right. So one of those muscles is the occipitofrontalis. Now, orbicularis oris, meaning that this muscle here is very important. If you are going to smile, anything, this muscle is there. Orbicularis oculi, anything you do on your face, this muscle is there. The muscle oculi here. Zygomaticus major. This is zygomaticus major here. You see, this is zygomaticus major, and this is zygomaticus minor. What is the difference between major and minor? Major is a little bit larger. So major is a little bit large, minor is a little bit small. All right. So the size is what differentiates them. So if you are naming them in the lab now, all you need to look at is to identify the two. The one that is larger is major. The one that is smaller is minor. That's all. Now, the third muscle there, the fourth muscle there, or rather the fifth muscle there is the buccinator. The buccinator. And yesterday when I was going to give the exam, I was giving exam to my students, and I was telling them that I was asking them that. So I was asking them which muscle compress the cheek and against the teeth, and that helps you when you are like blowing. Which muscle is that? Which muscle assists with mastication, that is eating, chewing? And I told them that's a password to access their test. And yeah, so the answer to that is buccinator. All right. So if you are thinking about it, buccinator, like buccinate, cut. All right. Again, masticator is there when we are talking about that, but this muscle is responsible. Those are part of the muscles of facial expression. Whatever happen on your face is a responsibility of these 5 muscles here. So those are the things I will expect you to know for the lab, for instance. For lecture, to know this category of muscles based on their group. Now, muscles of the eyeball, I will expect you to know this. Now, this is easy to know as well. Looking at this, like I told you, the grouping, the name tells you a lot about those muscles. Now, so they originate from the skull. Obviously, they insert into white part of the eye. Now, there are four muscles are rectors. And what does rectors mean? When you say
Straight.
thank you, rectors means straight, parallel muscles, right? Now, so it's parallel, straight, the same thing. Thank you. Now, if you look at this now, you see, so we have 4 of these muscles that are rectors, and we have 2 that are oblique. Now, oblique means they are at an angle. So rectors, this is a rectus muscle. You see, this is rectus, it's just straight. Now, we have another rectus here, but this is above, this is below. So this will be superior rectus, and this will be inferior rectus. Now, the other rectus, we have another rectus that is lateral, meaning that on the lateral side, okay, that means we are also going to have medial, which is going to be somewhere inside on the other side, okay, and that's what you are seeing here. This is a lateral view, this is a medial view. So this is the medial rectus. So that's all the rectus. Rectus, superior rectus, inferior rectus, lateral rectus, medial rectus. So all you need to know, if you are asked to know the muscles of the eye, is simply to know that we have 4 rectors and 2 oblique. And all the rectors, there's 1 superior, 1 inferior, 1 on the lateral, 1 on the medial. That's all. It's just a superior rectors, inferior rectors, lateral rectors, medial rectors. That's all the muscles. So if I'm asking you, even if your exam were to be theory or there are multiple choice, and the question is asking you which are the muscles that move the eyeball, all you need to take note is look for the rectors. Right? Now, the other one are the oblique. All right. So the oblique muscles, we have two of them. We have the superior oblique, which is the muscle here. That's the superior oblique. And we have the inferior oblique there. And so if you see the inferior oblique, this tells you clearly, this is not parallel. This is not rectus. It is at an angle. And this as well, that goes this way, is also at an angle, superior oblique. So those are ways to know. Those are things I need you to know the muscles that are responsible for some of these actions. Now, they are fastest contracting and most precisely the control muscles. Now, I will also expect you to know the muscles of mastication. Mastication simply means the muscles that you use in chewing. Now, the muscles of mastications are the masseter, and I joke with it. Masseter is, I think there used to be like a knife that is masseter, like they used to massage something to cut something. So think about it, that's the muscle that you use to chew, to cut something. All right, you are using it to chew. Then you have the temporalis, then you have the pterygoid. All right, so here are the temporalis. That's the temporalis muscle, and those are the temporal muscles. That's the masseter. And then the pterygoids are here. Now, these pterygoids, the lateral and medial pterygoids, they are deep muscles. So usually for labs, you may not be asked to identify them most of the time because they are deeper muscles. These are superficial muscles, so you could identify them easily, but these muscles are deep inside, except you have some torso in your lab or model that shows it more like this. But usually the medial and the lateral muscles, they are deep muscles, pterygoids. The pterygoid is, the P is usually silent, so it's pronounced pterygoid, not like pterygoid. All right. So the muscle that elevates your mandible, the temporalis, the masseter, the medial pterygoid, the muscle that help to retract your mandible, they are the temporalis. And then the muscles that help that protract the mandible are the lateral and the medial pterygoid. Now, the other muscle that I expect you to know are the muscles that move the head. Obviously, when you're thinking of the muscles that move the head, you think about the sternocleidomastoid, right? The sternum, cleido, and mastoid. They originate from the sternum and clavicle and insert into the master process of temporal bone. Temporal bone, I talked about that. If both move left and right, if both left and right are contracted, then what's going to happen? The cervical vertebra will flex, all right? And the head will extend at that point. If the cervical vertebra flex, the head extends, all right? Then contraction of one flexes the neck laterally and rotate the face in the opposite direction, all right? So this muscle here is a sternocleidomastoid. Like I told you, you see it goes from here, from the clavicle. You see it has the clavicular head, it has a sternal head. So you see this is the same muscle here. It's the same muscle that comes from here and here. It's the same. This is just one muscle, and it goes to the mastoid process of the temporal bone. So that's why it's called sternocleidomastoid, and is the one that move your head predominantly. All right. All right. So the muscles of the abdominal wall, we have the rectus abdominis. The rectus abdominis means the straight muscles of the abdomen. All right. Those are the muscles that we have that we call the six pack, right? And yeah, those are those muscles. We have the external and internal oblique. External means is outward. Internal means is more inward. Oblique means at an angle. Then we have transversus, which is like 90-degree abdominis, the form lateral border of the wall. All right, all right. So these are those muscles there. So you see, now if you look at this, it brings a little more clarity. So looking at this now, you see these are the parallel muscles. All right. So these are the parallel muscles. So you see rectus abdominis. Then when you come here, you see these muscles are not rectus. These muscles are oblique and they are external oblique. All right. Now, these are external oblique. Then you have this oblique as well, internal oblique. All right. Just in case I don't get to see the intercostal that I've talked about, these muscles are responsible for inspiration and expiration. So you see, these guys here is internal and it's between the costal ribs. It's between the ribs. So we call it internal intercostals, between the ribs. Then external intercostal, you see, between external means that it's more outside, right? All right. So those are those muscles there. Let's go. Then the muscles that are used in breathing, all right, that's what I was just touching. The contraction of the diaphragm. The diaphragm is the key muscles there that are responsible for breathing. When the diaphragm contracts, it flattens, and then the rib cage increases, right? Then the external, the external intercostal, right, contract as well, then elevate the rib cage. So diaphragm contracts, flattens, more like it deepens. Then the external intercostal contracts. The contraction of the external intercostal elevate the rib cage, so the cavity becomes bigger. All right, the thoracic cavity becomes bigger at that time, more like you are breathing in. Lungs have capacity now to enlarge because the thoracic capacity increase. All right, that is what happened during inspiration. Those are those muscles there. You have the diaphragm and the external intercostal there. Then when you are breathing out, what's going to happen? The internal intercostal is going to contract. When they contract, they depress the rib cage. Instead of elevating the rib cage, they depress the rib cage now, and then there will be compression of the thoracic cavity. The thoracic cavity lowers, it gets smaller. The diaphragm also contracts, and so it comes back up. Now the space inside the thoracic cavity reduces. That compress the lungs to push out the air in the lungs. CO2 comes out, right? So those are the muscles there. The muscles that stabilize your pectoral girdle, those are the trapezius, the levator, scapula. So like the levator scapula, for instance, now will elevate the scapula. It will move the scapula upward. You have the subscapularis. Now, subclavius. Now, let me tell you about this muscle that may interest you if it's here. It's not showing here now. Okay, cool. Now, look at this. I know some of you, this will help you in your lab as you confront those muscles. Now, you remember when you were looking at bones, when you look at the scapula, for instance, the scapula have the spine. And when we look at the spine, we say that there is a depression above the spine, which we call supraspinous fossa, and there's a depression below the spine, which we call infraspinous fossa. When you are looking at the posterior view of the scapula, do you remember that? Supraspinous fossa and infraspinous fossa. Let me know if you still remember. Okay, cool. Very good. Now, those fossa, they are muscles there. So the muscle in the fossa, or the depression above the spine, which we call the supraspinous fossa, that muscle is called supraspinatus. So it's simply saying the superior muscle on the spine, supraspinatus. So you see, that's this region here. This is the depression above the spine. Now, there is also a depression below the spine, which is going to be somewhere here. Now, this is going to be somewhere in this region now, but it's actually the muscle that is hidden here. All right. Now, there is that muscle here. All right. This muscle here. Okay, I'll talk about the other one later. This muscle here is the infraspinous fossa. So this is supraspinous fossa. These are the infraspinous fossa. So we call it infraspinatus. All right. Now, if you remember, there is on the anterior side of the spine, we call that, what do we call the depression on the anterior side of the clavicle, of the scapula? On the anterior side of the scapula, what do we call, there's a fossa there too on the anterior side. Will you remember that? So at the back, we have the spine, supraspinous and infraspinous fossa. And then at the front of the scapula, we also have a fossa there, which is a large fossa on the entire side, anteriorly. No, glenoid cavity is what is here that the humerus connect to form glenohumeral joint. So posteriorly, we have the supraspinous fossa, but inferior at the anterior side, which is, if you are looking at me like this now and you remove this thoracic cavity, then you are looking at the scapula from here. There is a fossa there. Let me remind you. Now, this is actually the issue. If you don't remember this now, it won't help you when you are naming muscles. Now, there is the fossa there. We call it subscapular fossa. Do you remember that now? We call it subscapular fossa. So the muscle there as well is called subscapularis. So it's simply knowing the name. If you simply know that now, you don't need to memorize. Once you know that area now, you don't need to memorize anything on that, because learning the bone is also learning that. So that muscle there is called subscapularis. You are not going to see it here because of the other muscles that are above it, but that muscle is called subscapularis. Yeah, it's not showing here because we are looking at the, okay, yeah, that's it there. This is the anterior view, right? So that's the subscapularis. So you see that? Here, the subscapularis. All right? That's the subscapularis. So it's part of the muscles that move the arm, for instance, now. So when you're talking about the muscles that move the arm, we talk about the pectoralis major. And I told you earlier, the pectoralis major is a major muscle here because it is on the pectoral girdle. So it moves the arm. Pectoralis major. So if you do press up, for instance, now, what you are going to notice the following day. Yes, supraspinatus. Let me go back to that slide if you are asking about it. So for the muscle, for those muscle there, we have the supraspinatus, which is posterior. You know this posterior view, right? So you have the supraspinatus, which is this muscle here. Then you have infraspinatus, which is here. This is supraspinatus, infraspinatus. Now, when you're talking of the bones, the muscle that move the arm, I use this actually. I use sit or sit L. Now, so I use the word, so you see, this is supraspinatus, this is infraspinatus, and this is teres major, teres minor. So it is ST sit. So supraspinatus, infraspinatus, teres major, teres minor. Or teres minor, teres major, if you go in that order. So that's supraspinatus, infraspinatus, teres major, teres minor, which is the small one, and teres major, the big one. Then when you come down here, you see the latissimus dorsi, all right, which is right here, latissimus dorsi. So I use the word sit L. Sit L. So the muscle that move your arm, sit L. Just remember supraspinatus, infraspinatus, teres minor, teres major, then latissimus dorsi. If you can go in the order the muscles are arranged, that will be the best. If you take note of them in the order they are arranged, because that will be the best for you to name them. Most of the time when you get to those torso, the truth is this: torsos is not the same as the real body, right? So um, sometimes, like now, you may not be able to differentiate teres major and teres minor because of the way the torso is. However, if you know the region, you know, and you see that the sticker is put on the upper part, you know that, okay, that's teres minor, all right? And if it is put in the lower part, you know that's teres major, even because of the way those muscles are structured sometimes. All right? Then on the anterior side, you have on the anterior side is where you have the subscapularis, all right? So you have the scapularis, you have the deltoid here, you have the pectoralis major here, pectoralis major, pectoral gadu, the large muscle there, pectoralis major. All right, here is still teres major, subcapularis. Those are still the muscles that move the arm. These are superficial muscles, these are deep muscles. All right, so I think that so take note of the muscles acting on the elbow. Those are the muscles I noted earlier. These are the gluteus muscle that I've been talking about. The gluteus medius is small, intermediate. Gluteus maximus is a large muscle there. All right, so you want to take note of those based on the way there. So you have the gluteus, maximus, medius, and minimus. The maximus extend the hip, and lateral rotation. The medius and minimum is what abduct. So when you're abducting your hips now, this is, I'm just using my upper limb because that's what you can see easily, right? Oh yeah, when you abduct, that is the medius and the minimums working there at that point. Right. So those are those muscles there. This is the medius, this is the minimus, and that's the maximus. Obviously, large, small, intermediate. Now, the thigh. When you come to the thigh, you talk about, on the anterior compartment, you talk about the quadriceps. We talk about the femoral nerve. I'll talk about that. We talk about the medial compartment. We talk about the abductors and the obturator nerve. In the posterior compartment, we talk about the hamstrings. Now, take note that quadriceps, it means it's made up of four in quote, four muscles thereabout, four heads. So we have the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Those are the muscles that we call the quadriceps femoris. Then what we call, so you just take note of those, what we call hamstrings. Those are the three muscles that we call the hamstrings: semimembranosus, semitendinosus, and bicep femoris. So those are the muscles that we call semitendinosus, semimembranosus, and the bicep femoris there. Those are the muscles that we call. So the bicep femoris have the short head. It also has the long head. Those are the muscles that we call the hamstrings. So when we talk about hamstrings, they're actually group name for four muscles, for three muscles. The same thing when you talk about quadriceps femoris, they are in quotes made up of four muscles as well. Now, when you say calf muscles, when you say the calf is contracting, we are talking about the muscles that we call the calves are these. So the three muscles insert into calcaneus, which is what we call the calf muscles around the tibia, right? And it's triceps surae. So they are the gastrocnemius, the plantaris, and the soleus. So those are the three muscles that we call the calf muscles. I expect you to know the hamstrings, for instance. Now, I just expect you to know, oh, the hamstrings are the semitendinosus, membranosus, and the femoris. I expect you to know the calf muscles are the gastrocnemius, the plantaris, and the soleus. So those are the things, those are the ways I expect you to know them. I'm not going to be asking you to identify the muscles on your exam. I'm just going to expect that you know those muscles. Yeah, I think that's where I'm going to stop. When athletic, when they are injured, they are obviously vulnerable to sudden and intense stress because of the level of the activities. The major injury that happened there is the shin splints, the pulled hamstrings, which is what is most common most of the time, tennis elbow. And the way they treat it is to treat it with ice, with rice. Rice is rest, ice, compression, and elevation. Uh, no pain, no gain is a dangerous misconception. You don't need to have pain. So some people now, when I was younger and I was learning to ride bike, they will always tell us that if you have not been injured, you have not learned how to ride. That the only way you know that you are a very good rider now is when you have sustained an injury. I don't buy that idea, and I don't think I really got injured the way people got injured because I don't believe in it. All right, so you could learn, you could do. It doesn't have to be no pain, no gain. There's difference between the discipline of discipline yourself, stay up to study. That's a good pain if it's in that concept. But if it's the pain, the this idea, right, that would be wrong. Subcutaneous intramuscular is the most. Okay, so uh, injections are usually done. I talked about this when I talked about skin. Subcutaneous is good way of uh, administering injection. Intramuscular is the most common site that is used, the deltoid, gluteus, medius, and vastus lateralis, then intravenous as well. All right, I'm going to stop that. That's just extra. It doesn't really, I don't need you to